watching WSBT 22 News at 5.
It is Valentine's Day, and February is American Heart Month. Two good reasons to be focused on your heart.
That's right, and Beacon just celebrated a major milestone. More than 200 procedures that have dramatically changed lives in tonight's Eye on Health.
This is your time to rise and shine.
All right.
Robert Widup farms and rides horses and has lived with a heart condition known as atrial fibrillation.
Blood thinners are a two-edged sword. It's a benefit and a risk.
And it's haunted him for nearly 2 years.
It keeps blood clots from forming in your heart, but it shuts off your body's defense system to clot in case of injury.
It's a worry that never leaves you, a constant fear of bleeding to death if you get hurt.
These patients are living in fear of bleeding. They don't complain to us. They don't let us know that, but it's always a very...
Dr. Mayank Mittal is an interventional cardiologist with Beacon who works with a team specializing in a procedure known as the WATCHMAN.
And what we do is we come from the leg, we cross over from the right side to the left side of the heart, and we deploy this basket.
It's an implant that doctors place in your heart to stop blood from pooling that would eventually lead to a stroke. A one-time, minimally invasive procedure for people with atrial fibrillation, not caused by a heart valve problem. More than a third of people with AFib feel trapped between the fear of having a stroke and the fear of the risks of taking blood thinners. The WATCHMAN is a permanent procedure that aims to treat both.
We've done the testing at 6 weeks and demonstrated that the procedure was successful.
Dr. Mittal placed one in Robert's heart 2 months ago.
Let me just listen to your heart, and then we'll get you out of here. It's a very gratifying feeling to see that sense of, oh, we're done with the blood thinners now. We don't have to, you know, I've seen people clap, I've seen hugs going around in the room.
I'd do it again in a heartbeat.
It's a very rewarding procedure and a very rewarding career.
90% of stroke-causing clots that come from the heart are formed in the area the WATCHMAN is designed to treat. Patients recover well from the procedure. They often continue taking blood thinners for about 45 days or until their doctor tells them to stop. And then they continue taking just aspirin. Dr. Robert had his procedure on his 38th wedding anniversary, so he has a lot to celebrate right now. For more information on heart care at Beacon, we have a link and a QR code on our website right now at WSBT.TV.